This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Did you know that the rules of dental care have changed for our children and grandchildren, specifically when it comes to fluoride?
The American Dental Association says it should be given to kids much earlier now. But how much earlier? Well, Brian Spiros went to Delmarva Dental Services in Salisbury to learn more about the new recommendations and why fluoride is so important.
If you have a child or grandchild, listen up. You may need to change their brushing habits. According to the American Dental Association, dentists are recommending fluoride toothpaste for kids earlier than ever.
Well, they found that 25% of kids have cavities before kindergarten, so I think they're trying to reduce the cavity rates in children. This is one of the easiest ways to do it with the fluoride toothpaste.
Dr. Joseph Harmon is a dentist with Delmarva Dental Services in Salisbury. He says fluoride is important when it comes to the strength of our teeth, especially at a young age.
Fluoride is an ion or a molecule that actually becomes incorporated into the tooth structure. So if you have fluoride in your enamel, the tooth is less likely to dissolve from acid or get a cavity.
Dr. Harmon says the new recommendations impact kids under the age of 3.
The American Dental Association recommends that you brush with toothpaste, but only the size of a grain of rice. But previous to that, they said just use water less than 2, but now they say less than 3. You should use that size toothpaste, the grain of rice size toothpaste, and brush with a small toothbrush. They have toothbrushes just for kids under 3.
The ADA also says that kids between the ages of 3 and 6 should be getting an increase of fluoride toothpaste. Every time they brush, they need to use a pea-size amount. So how do you know if your child's toothpaste even has fluoride in it?
It would say fluoride on it, but basically if it's accepted by the American Dental Association, it has the seal of acceptance, then it has fluoride in it.
While using fluoride toothpaste is the gold standard, Dr. Harmon says there are other ways to get it in your system. People who are connected to a municipal water system or consume processed drinks are getting the fluoride they need. But if you have well water, Dr. Harmon says you should be taking a fluoride supplement in addition to brushing.
It's been around since the 50s. In the 50s it was put in water systems, but now it's kind of taken for granted. And in municipalities, but people that we see higher cavity rates on the Eastern Shore than you would say in the metropolitan area, Baltimore, Philadelphia area, because of well water. So the cavity rates are definitely higher here because of rural areas and they have well water and they do not have supplements.
Okay, let's look at your teeth on camera.
Just like adults, kids should be brushing on a daily basis.
Ideally after every meal, but that's not an ideal situation. So I would say in the morning and the evening, and definitely twice a day.
But some parents know that's not always easy.
Well, you have to make it a game. One of the things that we used to do, or actually still do when we clean our teeth, is we say, well, we're going to clean the heads and the bellies and the backs of the teeth. You kind of animate the teeth, you know, give them a little personality.
Dr. Harmon adds that if your child is under 3, you will have to brush for them. 3 to 6, be sure to supervise, and of course, make sure they are seeing a dentist every 6 months for regular checkups. Steps that will give them a strong dental foundation.
So cute. Here is some other helpful information from Delmarva Dental Services. Before your baby has teeth, you should clean their gums after they eat with a wet washcloth or paper towel. Dr. Harmon says this will lessen the amount of bacteria on their gums. You should then start using fluoride once your child's first tooth breaks through. This usually happens anywhere from 6 months to a year.